Welcome back to ABA Exam Review and the continuation of our BCBA practice question series, where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out behavioranalyst.study.com for all of our study materials, including our combo pack and practice exams. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. For the first 3 months, your client's data showed rapid improvement in academic skill acquisition. You developed a plan that used a combination of response cost and differential reinforcement. The last 2 weeks, however, there's been zero change in the skill acquisition data. You want to know more, so you supervise the technician and notice that the response cost procedure is absent. What is occurring? Long question. We always start with the question first. We're not jumping into the answer choices. Let's understand the question initially. Question wants to know what's occurring. That doesn't give us a lot to go on. So what do we know so far? We know it's been 3 months. Your client's data was improving rapidly, and you developed a plan that used a combination of response cost and differential reinforcement. The last 2 weeks, though, no change. So we've gone from rapid improvement to no change in skill acquisition. Now, we could say, well, maybe they've maxed out on the plan, maybe the reinforcement schedule needs to change, but we always want to be parsimonious. So we always want to start with the simplest explanation. If we were rapidly improving and then suddenly we have no change for 2 whole weeks, we need to first check our fidelity, meaning we have to go in and do our supervision and make sure everything is still functioning correctly. So you want to know more, and you see the response cost procedure is absent. Well, what happened? Why is the response cost procedure now not present during treatment? A, observer drift. Observer drift has more to do with how we're measuring behavior. So if we had no change and you supervised and you noticed that your technician was suddenly measuring the wrong behavior, that could be observer drift. In this case, your supervision shows that the treatment is changing. And so what's happening is we are going through treatment drift. Now, this is very common. It's going to happen on every single one of your cases. It's up to you as the analyst to provide good and constant supervision. So when treatment drift does occur, you can stop it. 2 weeks is a long time. So ideally, we're not going 2 weeks with treatment drift, but it happened. What do? We've got to correct it. So treatment drift seems to be happening. What about C? Lack of external validity. We're not worried right now about external validity or generalization. We need to figure out why our internal procedures aren't working as well as they were before we can focus on generalization. And then D, lack of maintenance from the client. Well, we're looking for improvement. So improvement implies a change. With maintenance, that's a skill that's already been taught, already been mastered, and that the client can still do after intervention is over. We're not focused on maintenance here. We're still looking for that improvement. Improvement stopped, and we need to figure out why. So based on this information, it seems like treatment drift is occurring. You're trying to evaluate your treatment package aimed at reducing stereotypy of an early learner. You used a baseline condition, a timeout condition, and a DRO condition. What type of analysis would be used to identify how each element contributed to the behavior goal? So we have an analysis question, and when we think of analyses, we think of functional analyses, parametric, comparative, component. And so we have to identify which analyses are we using. And specifically, we want to know, how does each element contribute to the behavior goal? Well, what do we know about the element so far? We have a whole treatment package, and we're trying to reduce stereotypy. Our conditions were timeout, DRO, and baseline. So we have this timeout condition and we have this DRO condition, all part of a package looking at behavior reduction. We want to know what element contributed or how each element contributed to the behavior goal. So are we going to use an A parametric analysis? Well, a parametric analysis focuses on a single element, and a parametric analysis looks at how much of that element. We're not focused on a single element and the dosage. We're focused on each individual element of the package. So B, a comparative analysis, focuses on multiple elements, but elements that aren't part of a treatment package. And so this idea that this is a treatment package is very important to answer this question. Because what we're looking at is a component analysis. With the component analysis, we're evaluating each element of a treatment package. A comparative analysis, these elements aren't necessarily part of a package together. And then D, of functional analysis, we're not looking for the function here. We're not manipulating antecedents and consequences to identify the function. D is out. The elements we're looking at, well, this timeout condition, this DRO condition, they're part of a treatment package. So the type of analysis we need to use is C, a component analysis. Your best friend tells you that they are going to volunteer somewhere at least 3 times per month as their New Year's resolution. Your friend read that a good standard is to volunteer twice a month, so she will be using that as her benchmark for comparison. What is your friend utilizing? Looking at your friend's behavior here, and she's doing some sort of self-management. Talking about your friend measuring this, your friend monitoring this, your friend doing this, your friend doing this. What do we know? What is your friend doing? Well, your friend wants to volunteer 3 times per month. All right, immediately we need to start thinking, looks like measurement. This could be important. She wants to do 3 times per month as a New Year's resolution. The standard is twice a month. Why is the standard important? Well, she's going to be using that to compare her performance. So what we have is your friend programming treatment, essentially, to get her to volunteer more. And the way she's going to know if she's hitting these goals is by somehow evaluating herself. And how is she going to evaluate herself? Well, she's going to compare herself against this standard. So what do we call that? A, self-instruction. Self-instruction is just self-talk. When you're talking to yourself, when you're talking yourself through tasks, that is self-instruction. We don't have the friend talking herself through volunteering. What she's doing is she's evaluating herself. So with self-evaluation, you take a predetermined standard or a predetermined benchmark, and you compare your performance against that standard. That is what your friend is utilizing. It isn't self-management, or more specifically, it isn't self-management. More specifically, it's self-evaluation. Self-management could be much more broad. Self-evaluation is the more specific answer given the context here. And then it isn't a self-contract. Your friend did not engage into a contract or enter into a contract with herself. What your friend is doing is evaluating herself against this prior standard. B is the best, most specific answer. Your son asked for a song, Sleigh Ride, all throughout the Christmas season while in the car, and you always played it for them. Now, when they ask for Sleigh Ride, you don't play the song. What are you doing relative to their request? So let's think about this. It's a consequence question, right? Because we're looking at what you're doing relative to the request. So essentially, you're riding in the car, and then they ask for Sleigh Ride, and you don't play the song. Previously, what would you do? They would ask for Sleigh Ride, you would play the song. They kept asking for Sleigh Ride. You previously were providing positive reinforcement. We're asking for Sleigh Ride. Now, when Sleigh Ride is requested, you don't provide the reinforcement. You withhold the reinforcement because you don't play the song. So when we withhold reinforcement for a previously reinforced behavior, what do we call that? A, positive punishment. Be very careful with punishment and extinction. They're not the same. They're two very different principles. Punishment is a consequence that is added or taken away. Extinction is a consequence that is withheld. Here, we're not adding anything. You're not taking the song away because the song was never playing. You just don't provide the reinforcement anymore. You're withholding the reinforcement for a previously reinforced behavior, which was asking for Sleigh Ride. So what about B, negative reinforcement? Well, we know it's not reinforcement. We're not removing anything, and we're not attempting to reinforce the behavior. The reinforcement was coming in the terms of positive reinforcement for the song playing. What we're looking at here is C, extinction, withholding that reinforcement for a previously reinforced behavior. D has the same issue as A. We're just not using punishment here. Punishment is added, punishment is taken away, extinction is withheld. And here, reinforcement is being withheld for the request. So what are you doing relative to the request? C, extinction. You pass your board certification exam and are officially licensed as a behavior analyst. You receive your first client, so you, along with your technician, conduct indirect assessments and ABC narrative recordings. What should you do next once this data has been collected? We've got a task list item here, and this follows all of our descriptive assessments, our indirect assessments. Now we need to do something specific where we have done the indirect assessments, we've done the descriptive assessments. What follows that? Well, now we've got to do something with that data. And so what we need to do is A, we have to interpret this data and start to hypothesize a function. Before we can do B, our functional analyses, we need the hypothesis. How do we form a hypothesis? We form it through the indirect and the descriptive assessments. So the correct order, more or less, and right, everything is not cookie cutter, but more or less the way it should be done is you do your indirect assessments, you do your descriptive assessments, you form your hypothesis, and that hypothesis allows you to conduct B, the functional analyses. From the functional analyses, when you identify your function, you can then design your treatment plan based on that function. Once you have your treatment plan, then you begin stakeholder training. So think about that order of operations. You go indirect assessments and descriptive assessments. You then interpret that data and hypothesize the function. You then conduct your functional analyses, design the treatment plan based on the function you identify, and then you can do things like stakeholder training. A researcher is concerned that the functional communication condition that already took place may impact the results of his task chaining condition that is about to take place. What design might the researcher use next time to better control for this issue? Well, I would start by identifying what is the issue. What's the problem here? Before we can know how to control for it, we need to identify the issue. And the concern here is that this functional communication condition already took place and it might impact the task chaining condition. So when we have a condition that impacts the following or subsequent condition, what do we call that? We call that sequence effects. Sequence effects are very common in reversal designs. We're looking for a design where we can control for that, meaning what design is going to help us at least minimize sequence effects. Well, A, alternating treatment designs. Because with alternating treatment designs, you don't have to go through extended conditions with a single intervention. There are other issues with alternating treatment designs, but what it does do is help control for your sequence effects. A reversal design B is one of the biggest culprits of sequence effects because your conditions are longer and you're going condition to condition, and there's a good chance that one condition affects another. With a changing criterion design, you're not going to be changing up these interventions necessarily. Same with D, with the multiple baseline across subjects, we're not going to be changing up functional communication and comparing it to task chaining. So C and D aren't necessarily appropriate for both of these interventions. A reversal design is likely to make the problem worse, while an alternating treatment design might actually help us control for it. So to better control for these sequence effects, we're looking at A, an alternating treatment design. Thank you for watching. Check out behavioranalyststudy.com for all of our study materials. Please subscribe if you haven't already for our updates. Let us know when you pass so we can include you in the Sunday shout out. Work hard, study hard. We'll see you soon.